It's a pleasure to have Dr. Mary Kosek, who's professor of pediatrics and a neonatologist, a little baby doctor, from the University of Mississippi Medical Center here with us. What is the length of time that breastfeeding has been shown to be beneficial?
Well, it's recommended for at least 6 months, but many of the studies go on to up to a year and more.
You are especially intent on trying to get breast milk to premature babies. Why is that?
Well, the main reason is for the immunoprotective factors. And one of the most common conditions that we see in the tiny preemies is called necrotizing enterocolitis, which is a very severe bowel condition that babies can have, especially in premature babies. And we know that their breast milk has been shown to be beneficial for those babies, and we can avoid the long-term morbidity or the babies that die, or the mortality rather, or the morbidity, the complications of having that condition.
What kind of investigations are y'all doing at UMMC in this area?
Well, we've got one big breastfeeding study. We're looking with Dr. Ojeda. We are looking at the leptins in breast milk, and we've got a big study for 1,000. We're looking at 1,000 babies, and we're looking at the leptins in the breast milk that the mothers they give us, and also to look at their long-term growth of those babies. And we follow them either through the electronic medical record or through their pediatrician's growth parameters. And that's the biggest study that we have right now.
So leptin is something that controls appetite, and I presume why you're following that is to see if these babies tend to be obese, since we have such a big, or not protected from obesity. Is that it?
Yes, yes. Mm-hmm.
Yeah. And so does breastfeeding have any effect on weight later in life?
It does. The babies that have been breastfed for at least 6 months show a lower body mass index. The babies later on as adults have less problems with obesity and diabetes and metabolic illnesses.
And that's hard data. That's
yeah.
not just probability. It's really there.
Mm-hmm.
Yeah.
And that's after weaning out the variables in many different studies.
So we have such a low rate of breastfeeding. Why do we have trouble getting our moms to start breastfeeding and continuing the recommended period of 6 months?
Well, I think some of the reasons for not starting is just not having enough information, and not having the information of the benefits of breastfeeding. There's lots of cultural and social issues. There's young mothers. We've got a big teen population, and there's a lot of reluctance, I think, for teenagers to breastfeed.
Well, I've noticed as a fellow pediatrician that there seems to be a lot of confusion even among pediatricians about this. And when I first started training a long time ago, breastfeeding was very popular, and then all of a sudden formula began to be marketed. In fact, as a medical student, I got free formula for our children from the companies that make formula to encourage the use of formula, and now it's sort of swung back the other direction. So what's going on with that?
Well, I think that the information is out now, why it's better, and you're absolutely right that formula companies used to give us all free formula and a lot of perks to the families, that would give their babies formulas. They'd go home from the hospital with bags, and actually just getting that one sample of bottle formula can make a big difference on how long mothers will breastfeed.
So what are baby-friendly hospitals?
Baby-friendly hospitals are organizations that are nationwide and actually across the globe, although in the United States we don't have as many as they do in other countries, but they promote specifically breastfeeding in hospitals and recognize the merits of breast milk for babies, and the merits on not only the babies but their mothers and and society and the economy, and it's a whole educational type of a program that has 10 steps that we know are evidence-based to help mothers breastfeed successfully. Examples would be things like not providing pacifiers and not providing supplemental formulas, and getting the mothers to room in with the babies at least 24 hours, and to do something called skin to skin, where we get the babies directly on the mother's body and get them to breastfeed within the first hour of their birth. And we know that evidence-based that those babies do better in the long run, and they're more likely to stick with the breastfeeding. And we talked about that not going beyond 6 months, but we know if they do those 10 steps, there's a higher likelihood that they will successfully continue.
What do you say to moms that can't breastfeed?
I think as healthcare providers, we try to work with the moms. We give them the information and the merits, and do the supportive teaching, while they're pregnant, and the teaching postpartum, and we work with them. And it's really kind of up to the mothers and the families, whatever meets their situation the best. And I know that you're right. Sometimes people have a tendency to make them feel very guilty that they cannot successfully breastfeed for any certain amount of time, and sometimes they physically just can't. With the stress and with all the other things going on, especially the little premature babies that we have, they don't lactate, and I agree.
Can you tell the difference in your practice? I know you see a lot of premature children, between the preemies that are breastfed and the ones that are formula fed. Can you actually see the differences in those children?
We definitely see the decreased risk of NEC, because that's one of the first things when one of the babies develops that.
That's that colitis, necrotizing enterocolitis. And so you definitely see that in Mississippi in your practice.
Yes, we do. Some of the growth parameters, are not all evident in the very beginning, because over time we see the growth is better.
Another thing that we pediatricians seem to have been confused about over time is when to start feeding children what. And that seems to be changing again. So let me make sure I understand the recommendation. The American Academy of Pediatrics and other groups, including the government, recommend 6 months of breastfeeding. At what point is a minimum? And it's better if you can do it for a year, which is tough. So during that 6 months, when do you introduce solid foods or other foods, and what is the process?
Well, the American Academy doesn't recommend introducing any solids until 6 months. So the most important thing I think that families need to take home, the take-home message is that the protein that help their bodies and their brain grow is in the formula or the breast milk. The other things that they substitute, the rice cereal and the fruits and vegetables, those are kind of empty calories. They don't really provide a lot of protein.
So don't babies who are breastfed cry more and stay awake all night, and aren't they more difficult to handle?
Well, that's a good question. It may be just their nature. And I think sometimes mothers have a tendency, when babies cry more, not just mothers, but grandparents and babysitters have a tendency, when the babies cry more, to express themselves. They feed them more, and then they become big babies.
So what is the way this works in the hospital for the usual mom who comes in? At what point does the discussion start about breastfeeding? By whom? Does it start before? Do all the pediatricians talk to them, the pregnant moms, or the OBGYNs talk to them before they get in the hospital? Is the first time that discussion takes place prior to delivery, during delivery, after? How does that work?
It should start before, during their prenatal visits, and there's a big campaign to really get with the OBs and start that campaign with brochures and teaching, and even through the medical students meeting with the mothers prenatally. That's where it should start, and it carries on. I think the longer we wait to introduce the topic of breastfeeding, with a mom that comes and delivers at midnight, we miss that opportunity to really to tell them the merits and to kind of help them see the benefits.
Well, what I hear you saying is some OBs don't do this, and some pediatricians don't bring this topic up with a mom who's expecting, and so it takes place sort of during all this hormonal surge associated with delivery. And does that have a negative effect on the whole concept?
Well, certainly, because the mothers are, after they deliver, they have an early discharge. They may be discharged within 48 hours. So really, you're right, but they're still having postpartum depression, and they're having pain, and they can't really comprehend all the things that we need to kind of teach them. So, but it goes on to after they go home. I mean, we still have the lactation specialists and the pediatricians, can encourage the breastfeeding, but the best time is before when they're pregnant.